advanced fibrosis or progression to cirrhosis, currently we manage it by managing complications. We don't have any good techniques for undoing that other than stopping the process and waiting for natural recovery. If we can find medications that accelerate that natural recovery, that is, they undo the fibrosis, we may see patients getting better very quickly, and that would make life easier for everyone, including the patient, the family, and the medical societies. The standard of care is very frustrating because patients frequently, even once they know what they need to do, have a hard time doing it. And so in the future, I'd like to find ways that tap into people's behavior and improves the way they see their condition and their motivation for getting healthier. I would like to see health agencies take a more active role in promoting health rather than curing health problems. I think payers are more focused on managing health problems than on preventing poor health. I would like to see more programs that deal with this proactively and encourage people, educate people how to live healthier lives and encourage them to develop healthy habits that prevent disease rather than treating the disease on the back end.
What we would really like to see is more awareness about this disease, not only from healthcare, but also patients, because this disease can be very silent. And if there's no awareness, screening doesn't happen. So more awareness and also more tools to aid in lifestyle modifications and eventually pharmacotherapy is really what we need to attack this disease.
One of the strategies to increase access for care is to increase education, especially in the primary care setting, endocrinology. Another strategy is performing cost-effective analysis to make screening an effective tool to recognize more patients. And therefore, it goes into the primary care as well as the endocrinology and gastroenterology guidelines and start recognizing these patients that they're so widely available out there, many of them are not diagnosed. Many of the experts in the field as well as activists against this disease have been trying to educate the community via talks or educational seminars to tell these people this is a real risk out there that we need to target, as many patients are asymptomatic, get undiagnosed, and need to be recognized. The payer organizations have been active in looking for the causes of this disease, learning about the disease, learning about the non-invasive strategies, screening strategies to recognize these patients. Fortunately, many of them now are aware that these patients are a real risk for health economical changes and big complications. And therefore, a huge effort now have been started from multiple payers. One, to recognize these patients. Two, to diagnose them with advanced fibrosis. And three, to come with the best strategies to manage them, including looking at the drug discovery in the pipeline.